Welcome to The Explainer. Today, we're digging into something that affects millions of people, chronic pain. But we're going to look at it from a totally different angle, a framework that looks past the symptoms to find the hidden story your body might be trying to tell you.
So let's just jump right in with a question that, honestly, it kind of messes with your head a little. What if the pain you're feeling in one spot is actually a signal from somewhere else entirely? It's a huge idea, and it's really at the heart of everything we're about to unpack. To get to the bottom of this, we have to completely reframe chronic pain. So instead of seeing it as just a localized problem, like a faulty part in a machine, think of it more like a complex mystery. The real clues, they're not just at the scene of the crime. They are spread all throughout your entire system. And this is exactly what practitioners of traditional Oriental medicine, or TOM, do. As the expert David Salgado puts it here, they basically act like detectives. They don't just stare at the pain itself. They're looking for a whole constellation of signs to get the full picture. So what does this detective work actually look like in practice? I mean, how does a practitioner read the whole body to find clues that something like an MRI or an X-ray might just miss completely? This slide just lays it out so perfectly. On the left, you've got the conventional view. It's like a microscope, right? It zooms way in on the one spot that hurts. But on the right, you have the TOM view, which is way more like a telescope. It zooms out to see the whole system, your posture, your complexion, the way you move, to see how it all connects and find the real root cause. Okay, so one of their key tools is pulse diagnosis. And no, this is not just about counting your heartbeats. By feeling the pulse at different spots and different depths on your wrists, a skilled practitioner can get this incredibly detailed snapshot of how all your internal organ systems are working. It's a really sophisticated tool, and there's just no direct equivalent to it in Western medicine. And check this out. Here's another fascinating source of clues, your tongue. Seriously, its color, its coating, its shape, all of it can reveal a surprising amount about your digestion, your circulation, and even patterns of inflammation that could be contributing to pain somewhere else entirely. And this right here shows what that kind of whole body diagnosis starts to uncover. Your chronic back pain? It might actually be connected to poor digestion, or maybe some emotional stress you've been carrying, or even just sluggish circulation. These are the kinds of hidden factors that often get completely missed when the focus is only on the pain itself. Now, this whole body approach leads to a really critical factor, time. It turns out that when it comes to pain, timing is, well, it's everything. Acting early isn't just a good idea from a traditional standpoint. Modern neuroscience actually confirms that the longer you wait, the harder pain is to treat. As David Salgado puts it so simply, chronic conditions just take more time to heal. And that's because over time, pain doesn't just stay in the body. It gets wired into the nervous system and even into the mind. And science has a name for this whole process, central sensitization. It's a state where your brain and your spinal cord basically get wound up. They become hypersensitive and way more efficient at creating the sensation of pain, sometimes even after the original injury is long gone. This slide breaks down exactly how that happens. So first, step 1, you have an injury. Normal. But then in step 2, for some reason the pain signals just don't turn off. The alarm keeps ringing. And that leads to step 3, hypersensitivity, where the nervous system itself starts turning up the volume on those signals. By the time you get to step 4, the pain pathway is its own thing, a self-sustaining loop that can keep going without any real cause. So the crucial point here is that getting in there early can actually interrupt this cycle before it gets hardwired. And this isn't just a theory. Modern research totally backs this up. For instance, a study in the Journal of Pain found that when patients got acupuncture early on, they needed significantly fewer treatments to get better results. Acting fast can literally save you time and pain down the road. So all of this, it leads to a really powerful, and I think for a lot of people, a really liberating idea. True healing isn't about being a passive person who just receives treatment. It's about becoming an active participant in your own health. And that idea is the absolute bedrock of the whole TOM philosophy. Yeah, the system itself can be incredibly complex, but the starting point, well, it's beautifully simple. It just begins with how you care for yourself. Okay, so let's dig into what this self-care really means. TOM points to these 4 pillars of health: using your mind harmoniously. That's not just about positive thinking. It's about reducing the stress hormones that create inflammation. Moving your body properly.
That gets your circulation going, bringing nutrients in and taking waste out. Eating healthy food, that's literally the fuel for your body to repair itself. And having a calm home environment reduces that constant low-level stress that just drains your system. These aren't just nice-to-haves. In this view, they're the absolute foundation of health. And this, right here, is the ultimate mindset shift. It moves the power from some external treatment back into your own hands. It's no longer about what a doctor can do to you. It's about what you can actively cultivate in your own life every single day to build a solid foundation of health. So after looking at all of this, what's the single biggest idea to walk away with? What does this new perspective on pain really give us? It's this. Chronic pain is not a broken part. It is a signal. It's a message from this intelligent, interconnected system that's asking you to look a little deeper, a little broader, to investigate that entire constellation of your health. And that leaves us with one last essential question. It's not for me to answer, it's for you to think about. If your pain is a message, what is your body trying to tell you?
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.